The BMA Resident Doctor Leader, Chair of the BMA's Resident Doctor Committee, is Dr. Jack Fletcher, who joins me live. Thank you very much indeed for coming on the programme, Doctor. What was wrong with the offer made to you?
Good afternoon, Tom. So I think there was a number of things wrong with it, and frontline doctors have emphatically rejected it for a number of reasons. The first one was there have not been a doubling in specialty training places. There will be no more doctors at the end of this offer, and yet sort of doctors are working in A&Es right now in corridors to provide patient care. And what we're saying is we need more doctors. What we don't need is a reshuffling of the deck chairs on what feels like increasingly feels like a sinking ship. And all of those jobs were just repurposed jobs. There were no new jobs in there. In addition to that, more doctors last year than in the last decade left the NHS in this country because they are not valued. And what we're asking for is a credible path towards restoring pay over a number of years, nothing in one go, but serious conversations of that, because what we do have at the moment is this government pushing real terms.
Dr. Fletcher, you are having serious conversations because the current health secretary has offered you, or did offer you, a 28% pay rise over the last. That is a serious bump in pay on the way to, and Wes Streeting has talked about this already, on the way to various talks about full pay restoration. You're getting there.
So we fully recognise that was an uptick for the first time pretty much in well over a decade, that we'd had a real terms pay increase. However, that is not true. The Health Secretary is quietly pushing real terms pay cuts onto doctors in this country in 4 months' time. That is where we are.
By doing what?
Sorry?
By doing what?
So he is recommending, his government have recommended a real terms pay cut to doctors in the new year.
Of what?
Of 2%, less than inflation.
So your pay increase would be 2%?
So our pay increase, the government has recommended a 2% below inflation.
Yes, but you've had a 28% pay increase over the last 3 years, Dr. Fletcher. That is significantly above inflation.
So when we saw that double-digit inflation a number of years ago, it wasn't significantly above inflation. It was keeping up, and it was a start, to use Wes Streeting's language, towards a journey of pay restoration. But we're asking to continue that journey.
You're asking to continue that journey by going on strike?
Because the Health Secretary is U-turning on that journey by recommending real terms pay cuts. But it's not just about pay. We are turning tens of thousands of doctors right now away from jobs in the NHS in this country. What we see is patients lying in corridors. Forget about industrial action for a second. In October, a month without industrial action, more than 54,000 patients lay on a trolley and received care for more than 12 hours. And yet we are turning 13 fully qualified A&E doctors away from jobs in the NHS. This jobs package will still turn thousands and thousands.
Right, so let's come to that. So one of the things that you've been offered is emergency legislation to enable prioritisation of UK graduates and other doctors with significant experience working in the NHS for specialty training posts. What's not up to snuff there?
So there are no more doctors at the end of this. So that's why we put it to members, because emergency legislation is important. So we put it to our members, and they have emphatically rejected it. We've had nearly 30,000 frontline doctors in the last 72 hours say that this deal, because there are no more jobs at the end of it, will still
When you say that, just to be clear about this, because they're going to introduce 4,000 additional specialty training posts over the next 3 years, up from the 1,000 announced in the 10-year health plan. So that's an increase over the next 3 years of many, many more training posts.
So what that is a repurpose of those jobs. So those jobs are not new jobs. We're just taking jobs which are currently local jobs, which are on really insecure, sometimes 6-month contracts, and saying, let's turn them into training jobs.
Yes.
That is a step in the right direction, which is why we put this offer towards members. However, if you do not then get one of those training places, then you're going to have the likelihood of you being unemployed and wanting to leave the UK as a doctor skyrockets, because there are actually fewer jobs in that pool that remain than there were at the start of this deal. We've said...
But hang on, because one of your asks was you wanted additional specialty training posts. You are getting 4,000 additional specialty training posts.
What we're getting is repurposed jobs. There's no new jobs
So
here.
these are converted from LED posts, locally employed doctors. That's what that stands for, right?
Yes, so this is 1,000 extra of those training posts this year, but yet we turned away 30,000 doctors applied for 10,000 jobs this year. So 30,000 doctors.
But you're getting more opportunities for those same doctors to apply for those specialty training posts. You're turning down the opportunity. You are. It's going from 1,000 to 4,000. I appreciate the point that they are not. They are converted from those LED posts, but the Secretary of State is saying your ask was for specialty training posts, and here they are.
So our ask was not for just specialty training posts. Our ask was to get more doctors on the front line. Yes, specialty training posts are a big part of that, but it's not the only thing that is part of that ask. What we are doing here, let's just go through the numbers very quickly. We have nearly 40,000 doctors who will be applying this year for around 10 or 11,000 training posts. We are still going to turn away tens of thousands of doctors from the NHS in this country, and we're still, on top of that, we're then going to potentially limit the jobs available for those doctors who don't get into training.
So how many more jobs are we at the stage of saying every trained doctor in this country, if they want a job in the NHS, needs to be able to get one?
What we don't want to do is we don't want to see doctors who are fully qualified be turned away from jobs. You talk about those locally employed jobs, which are the ones that are going to be repurposed for the training posts. I see friends and colleagues applying for those jobs with competition ratios of even worse, something like 300 to 1. That is clearly an unsustainable situation to be in. However, we do need more doctors. So what we're saying is, this is a good start on the jobs front. It doesn't fix the problem. There are no more doctors at the end of this. However, we recognise it's a good start, but there are some other things in there that are needed to make sure that the doctors who are trained in the UK and those currently working here aren't massively disadvantaged at this, which is a serious risk based on the current offer.
Wes Streeting now says that your pay rise requests are a, quote, so I'm quoting him, fantasy demand. He's going to come on the programme in the next hour and a bit. What would you say to him directly?
I don't think it's a fantasy demand to ask for our pay to be kept to keep up with inflation, let alone to return to the value of what doctors were in 2008. We're not asking for anything overnight in one go. We're asking for a credible offer that lasts potentially a number of years, and in exchange, we would see an end to industrial action by resident doctors over the next few years, if that's a credible deal. It's really disappointing that we're in this position, despite my repeated asks to get round the table, which have fallen on deaf ears. The Health Secretary did not even reply to my letter following the last round of industrial action, which has meant that we've got no choice but to announce more industrial action.
You do have a choice.
The Health Secretary suggested that we put this offer to members. We've put this offer to members. They have emphatically rejected it, and that's where we are today.
Do you accept that you are putting patient safety at risk by taking this strike action?
So this comes up quite a lot. Patients are at risk every single day in our NHS. If we just rewind the clock slightly, earlier this year, a coroner's report in the area that I'm from, in Newcastle, came out and said that a patient died because there was not a particular life-saving stroke intervention which could be delivered outside of Monday to Friday 9 to 5. That is because we do not have the specialists to be able to deliver that care, and yet we are turning away, even with this jobs offer, thousands and thousands of doctors.
Yes, I noticed, Doctor, you've done a good job there in just spilling out from the question that I asked, which is, you have to, don't you, take responsibility for the fact that patients will be put at further risk by resident doctors going out on strike?
So I was going to bring that back to
patient
risk. We see patients at risk without industrial action in the example I've just given. Bringing it back to patient risk right now, we have been on industrial action for a number of rounds now. Our senior colleagues step down and cover our work in A&E and acute medicine, which is where I work. So my consultants will be working this weekend to allow us to take safe industrial action.
But sorry, this is just a complete misnomer, Dr. Fletcher. The whole point of going on strike is to create a degree of disruption that shows that your work is valuable and relevant. Otherwise, if you were to go on strike and nobody noticed, then no one's going to bother about you being on strike. You accept, don't you, that there will be patients put at greater risk, people left waiting longer for various forms of treatment because you are going on strike at an incredibly difficult moment for the NHS?
Yeah, so what we ask for is we ask basically for non-urgent elective care to be reduced during times of industrial action, and that is completely avoidable. Completely avoidable. If the Health Secretary had have replied to my letter on the 19th of November, when there was not a single day of action planned, to get round the table and get a deal done, potentially to see off strikes for a number of years to come, if he had have heeded that call, we wouldn't have even announced any more industrial action.
Right, so my listeners who might miss their appointment or not get their surgery this year or have to wait until the new year, you say what?
I am sorry. I am sorry that we are in this position where it takes strike action to get the Secretary of State for Health to even come to the negotiating table to talk to us about the fact that we are turning doctors away. Some doctors face unemployment or ad hoc shifts, and we have record numbers of doctors leaving our NHS. Let's get round the table and get a deal done to avoid industrial action, not just this week, but also for years to come, potentially.
Dr. Jack Fletcher is chair of the BMA's Resident Doctors Committee. Thank you very much indeed for coming on the programme. Strikes that are, according to the Health Secretary, self-indulgent, irresponsible and dangerous.
Let's talk to Ishani in Bromley. Hello, Ishani.
Hi, thank you so much for having me on. My name is Ishani, or Dr. Rao, yeah.
You're a GP, busy time, I'm sure, Ishani.
Absolutely, yeah, I'm a GP across Guy's, Tommy's, King's, Lewisham, Croydon, so covering all my favourite hospitals.
So tiny population of people, yeah.
Exactly.
Yes. Not many people live in those places, do they?
Yeah.
Yes. So do you support what they're doing?
Absolutely. I was the strike lead for my hospital during my GP training. Loads of my friends at the moment are, heart surgeon trainees, A&E doctor trainees, paediatric trainees. I say trainees, they're 35, 36 years old, and we've been junior doctors for the last 10 years. But we're not inherently just striking about pay, although it would be nice to be remunerated for the hard work that we do. We are striking because the conditions that we're put in at the moment are unsafe. The conditions that patients are under at the moment, because of the lack of staff, the lack of NHS retention, looking at why people don't want to work in the NHS, it is unsafe. We are covering 3, 4, 5 colleagues' jobs on an average night, and that's not just doctors, that's nurses, that's secretaries, that's porters, that's cleaners. It is inundated, and the government don't seem to think that the NHS needs expanding and that it needs to look at why people don't want to be working in such a strained and unsafe system. I was doing 13-hour night shifts 4 or 5 days a week as a junior doctor, plus the commute. We were sleeping in cupboards. We weren't getting a break. It was unsafe. I'm still being paid less than all of my other friends that are doing corporate jobs and went to Oxford and Cambridge, etc. So it's not about the pay. It is actually about the quality of care that we can provide to our patients. And we're saying that it's not adequate at the moment. We need to be thinking about the long term, not just 5 days over Christmas.
Well, it's also been, correct me if you think I'm wrong, but hasn't it also been about the accessibility or the availability of training places? Now, you're right to point out that we're talking here about people into their 30s, very qualified already, but they want specific training places to improve their skills on the journey towards being a consultant, perhaps in whatever field they want to go in. And Wes Streeting was saying here on LBC last week that he was offering a deal where the ratio of your job chances in those training posts would go from 1 in 4 to 1 in 2 under this deal. I mean, that's a massive improvement, isn't it?
It's a massive improvement, but if we're looking at the ageing population, if we're looking at the levels of chronic disease, if we're looking at the number of people and patients and UK general population that need doctors, then why is this not being increased even more? Why are my friends who are, already almost consultants, why are they worried about finding a job? Why was I struggling to get a GP training post? I don't understand why there is not more.
Is the answer money? is the answer money? Because people are expensive, aren't they?
People are expensive, but also if the government wants to actually protect our population, then they need to put in the investments into training posts and into consultancy places. My friends, they're leaving to Australia, they're leaving to Canada. I'm looking at jobs in Gibraltar in Spain. You know, people are worried about actually getting jobs in the future. So why is that the case when we know that people need care and we want to provide that care and we want to do it safely and adequately?
And are you feeling the pressure of the flu as a GP?
Yeah, it's horrific already. You know, our urgent cares are inundated. I'm across London hospitals working in urgent cares, and there's so many staff off with flus at the moment. So it's not just our patients who are, you know, being impacted by the levels of kind of viruses and flus at the moment. It's so many people, and it's really, really difficult to see the queues out of the door that we are having to turn away when urgent care shuts. It's heartbreaking to walk past A&Es where people are queuing up for reception because we want to provide care.
Is Shani, taking into account, I hear what you've said about all of the difficulties, and I don't doubt it's an incredibly difficult place to work in many ways. I
love my job.
No, I get, you know, you can love I love my job, but it's sometimes stressful. That's fine.
Yeah.
You know? But if the health secretary, as he did, said, look, we'll keep talking, have your ballot, there's your offer, have your ballot, but can we do it in January when this is over? Or in early Feb, whatever the date was he suggested.
Because this is not over. The NHS is always inundated.
You don't think it's about the flu?
I don't think this is about the flu, and I don't think this is about Christmas timing. You know, the flu doesn't go away. January, February, we saw it in September, October, November, December, January, February. This is not just 1 week where there's going to be queues outside A&E. This is a long-term problem. This is all year round now.
All right, I must leave it there, Ishani, but thank you very much for your call. That's Ishani, who's a GP in the Bromley area. Anthony's call from Farnham. Hi, Anthony.
Oh, hello. I'm a consultant in the NHS, and I just thought I'd call about the picture that's being painted by Wes Streeting at the moment, which I think is somewhat unfair, and I think the government's sort of media picture is much better than the BMA's, if you like, the public relations issue and what goes out there. I think on two things, and let me start by saying that actually Wes Streeting did start very well in his role as the health secretary, but it's sort of recessed into usual politics. I would say, with regard to the flu itself, the only difference this time is that it is an earlier peak. It's an earlier rise. The peak is going to be exactly the same. It's just that it's happening earlier. So the NHS is no more overwhelmed currently than it has been in every other year so far. And we as consultants have to do the work whilst the juniors are striking. And we're going to do it again, and it's going to be no worse. It's just a bit earlier. So that's something that they're making something big of when actually it isn't really. The second thing is that I would say, and I know for the fact, that the juniors would have probably accepted Wes Streeting's offer if it hadn't been disingenuous. It wasn't
Why is it disingenuous?
It wasn't about pay this time. It was. I think they would have put that on the back burner. But it's about the offer of the jobs and all of that. You know, if the BMA made public, and there was once or twice, I think Nick Ferrari had one of the BMA resident committee on last week, who actually made it quite clear that when Wes made the offer and they asked him for the detail, he refused to come back with the detail. In other words, it was less than clear how the government were going to achieve what they said. And even for the extra 1,000 jobs, it was clear that it was only for a year.
Well, he did try. Well, my assessment of listening to Nick's programme when he was on was that the health secretary, that is, that he tried to explain that the way they would make 1 in 2 training places available as opposed to the current 1 in 4 was by changing legislation on who could apply. That sounds pretty concrete.
Yes, I know, but it wasn't. It was actually the figures and how the numbers they came for. And when the BMA representatives asked for their calculations, they declined. They would not declare. I mean, doctors aren't stupid people. When they look at an offer, they'll look at it, quite carefully because it's politics. And when you're fudging the numbers, and in fact, even if that thing was about the legislation. It was only going to be for a year, and how can they guarantee how it's going to go through? And actually, all they were doing, what the suggestion was converting what are called trust jobs, doctors working in trust grade jobs, to training jobs. Well, even if you do that, who is going to train that extra number? Because it's us consultants. Are they? So then you mean you've got all those extra guys doing residency training and specialty training, but the same number of people then trying to train them, and that dilutes their experience. It is clear that they're not addressing the problems at their root. And even if they changed that competition ratio, they wanted clarity about how it was going to be achieved in the long term. And if there had been clarity from Wes, I would have guaranteed that this time they would have gone, okay, let's go with Wes.
Am I right? Am I right to say? Well, hang on. Am I right to say that the only way to achieve a better situation in the long term on the ratio of consultants to training doctors, if you've got more on one side and not on the other, is more doctors?
Yes, of course it is, but it's been done in such a silly way. For example, bringing in all the international medical graduates which we've needed, and at the same time increasing medical school places, and they're not doing anything about planning how you're going to do that going forward. And there's, again, just saying, increasing is not addressing the problem in the longer term. Just like the pay issue, it's not promising to say, yes, we can address this in the longer term. It's just a blank no on that. But let's leave that aside, because that is a blank no. And I don't think the resident doctors are actually, would have put that aside if there had been clarity on how you're going to achieve an increase in the competition races, not wasted to doctors not going abroad. And from my point of view as a consultant, these are the people that are going to be treating me at some stage in the future, and you. And we're not getting them. Clarity is necessary from government, and not this sort of nefarious type of workings out, which will not pass because doctors see through it.
14 strikes since 2023. Where's this taking us?
It's taking us to a point to make politicians of any colour understand that this is not politics anymore. It's actually about fixing something which is necessary. Fixing part of the NHS which is necessary in the long term, not the usual 1 or 2 year fix.
Okay, I must leave it there, but thank you very much indeed, Anthony, calling from Farnham, a consultant in the NHS.